Good morning. My name is Celia Serrano, and I'm a community health worker with Family First Health. Today, we're talking with Dr. Luis Garcia, one of our medical providers at George Street Center in downtown York, about some common scenarios we've seen and heard from patients and people in the community over the past couple of months related to COVID. As the number of COVID cases continues to rise, it is important that we have accurate information to guide our decisions and keep our families safe. Dr. Garcia has been a trusted source of information within Family First Health and within the community on the impact of COVID-19. We are pleased that he is taking some time to offer his insight today. Welcome, Dr. Garcia.
Thank you, Celia. Thanks for having me.
Thank you for being here.
Of course.
So, Dr. Garcia, we have some scenarios here we like to walk through to get your insight. Let's get started.
All right, sounds good.
Our first scenario is one of your students have COVID symptoms, but feel fine and don't have a fever.
Hmm.
You believe it's just a cold and not COVID. What steps should you take?
Yeah, this is a good question, and I hear this a lot, especially from parents. The reality is that COVID presents many times just like your normal cold. You get a stuffy nose, you get a sore throat, a scratchy throat, a little bit of a cough, and so these extreme cases of COVID that we hear about in the news of body aches, fever, chills, trouble breathing, all these things, that definitely happens, but most people, it actually presents just like your regular common cold. And so there's no way for us to know just from someone's symptoms or lack of symptoms if they have COVID or not. The thing to remember right now is that we are in a pandemic. And so what that means is that we have to be very, very careful and very cautious whenever somebody begins to have symptoms that could be COVID. So if you do begin to have these symptoms, then one, you need to talk to your doctor, your medical provider, and see if you can get tested. But two, you really need to start quarantining at that time as soon as you begin to have symptoms like that. Even if you think it's just a cold, there's no way for you to know that it's not COVID. And what we want to do is limit the potential exposure to other people in the schools, in work, and out in the community. And so quarantining is the best thing to do in that situation.
Right. And even running errands. What should they do if they're going to the grocery store or running errands or need to go to the store?
Yeah, that's tough. I mean, here we're talking about the student, your child, right, is having some cold symptoms, and you as the parent, you're not having these symptoms. If you can have somebody else pick up the groceries for you or run those errands for you, that would probably be ideal. Because if your child does end up having COVID, then you've probably been exposed to it as well from your child. So you want to limit your contact and your exposing that out in the community. And if your child is getting tested for COVID, then you need to let your work know that you're waiting on someone in the household to have a test result back, and then they can talk to you about their policies and what they want you to do in that situation.
Thanks for that. Okay, here's our second scenario. Another scenario we've come across is a parent or family member who lives in the home of a student has COVID-19 symptoms, got tested for COVID, and is awaiting results. What steps should this parent take?
Right. So anytime you're waiting for results for the COVID test, unfortunately, sometimes it can be as soon as 2 days. It could take up to 5 days or maybe even a week if the testing is really burdened. But at that time, you, the child, and anyone that's been exposed to that child should really quarantine for 10 to 14 days. And so that's tough. I mean, this is all a very difficult situation. So that means that the child isn't going into the school. Now, a lot of places are doing virtual school, and they should still be able to participate in the virtual school while they're waiting for their results. But the parent needs to let their employer know and talk to the employer and their human resources department as to what the policies and actions they should take at that time.
That makes sense, Dr. Garcia.
Mm-hmm.
So the goal is to ensure that the family is not contributing to the spread of the virus.
Yes, and again, like I want to emphasize that this is a difficult situation. It's not an easy situation because there's a lot of waiting involved, waiting for the results, waiting for the quarantine to be over. So I just want to acknowledge that it is very challenging.
Yes. Okay, our next scenario builds off the previous scenario. Let's say that the parent or family member receives their COVID-19 test back and it is positive. What steps should this parent take?
Well, so this is, this I think is kind of the more clear example of where you should quarantine for sure. And the previous ones definitely as well. But in this one, obviously the child can't go to school, so you got to contact the school. Or I'm sorry, you have potentially exposed your child, so your child shouldn't be going to school. Your child has been exposed, so you need to contact your child's doctor to see if they should get tested as well. In most cases, they should be tested as well. And your doctor can decide when would be the best time for that child to get tested. As the parent and the caregiver, you need to again let your employer know, talk to your human resources department, and definitely be quarantining, between 10 to 14 days after you had your test completed, or after your symptoms started. So yes, you should have your student, your child, be tested as well.
And it should be communicated to the school as well, so that
Right.
way it doesn't impact their attendance if they're waiting for COVID tests and or the child is sick.
That's right. And anytime you test positive, you really have to let anybody that you've had contact with, close contact with, know that you tested positive and that you potentially expose that other person to COVID.
Okay. So what I'm hearing at this point, the family should take extreme caution and ensure they are not interacting with anyone outside of the home. Is that right?
Yes, that's absolutely right. But I want to just make something clear here, because what I'm seeing a lot of right now is transmission within families, so within households, and so sometimes like I had this one patient. She says to me, "Doctor, I don't know how I got COVID because I don't leave the house. I don't go out. I don't do anything out of the house. I just stay here. And nobody comes and visits me at home." And I said, "Really? Nobody comes to visit you?" "Well, my son comes in and out sometimes, and my cousin comes and visits me, and but they haven't been sick, so I don't know how I got COVID." Well, see, here's the thing, is that many times people have COVID, but they don't have symptoms. And so we, even within our families, even with our loved ones, we have to be very, very careful, extremely cautious, extremely careful, especially with our older family members, our grandparents as well. We have to be very careful because we don't know if we have COVID, right? Because the first few days, you're not going to have symptoms. And those are the days that it's contagious, that you could be spreading it to other people. So, this is what's happened kind of in the past couple of months with Thanksgiving, with Christmas time. We've let our guard down. We've spent a lot of months, very careful, very cautious, everybody wearing masks, everybody doing the distancing thing. But the reality is that we're getting tired of it. I mean, I'm tired of it. Everybody is tired of it, but we're still in a pandemic. The virus is still out there. Our hospitals are getting filled up, and to the point where they're turning people away because they don't have room. And so if we want to do our part to kind of help as a community prevent this from getting even worse than it is, then we need to be careful even within our own households, even within our own families. We have to maintain an extra level of caution.
Okay, Dr. Garcia. Thank you for that.
Yes.
Our final scenario is, what if a child has symptoms of COVID and the parent or guardian does not have someone to watch the child while the parent goes to work? What would you suggest?
Yeah, this is probably one of the most difficult situations. And here, again, you're talking about a parent that's potentially exposed to those symptoms, without a definitive diagnosis yet. So of course, you're going to get your child tested for COVID. But what do you do while you're waiting for those results? Well, you have to let your employer know, because if your child does end up having COVID and you've gone to work during those days, then you've potentially exposed the people at your work with COVID. So again, you're not going to have symptoms until 4 or 5 days after you've been exposed to it potentially. So you have to be very, very careful. And so this is where you have to contact your employer, talk to your human resources department, and they can guide you and decide, okay, is this something that you need to quarantine for or not? And then once you do have that result, if it's negative, then you can contact your employer. Hey, it was negative, and they can decide if you need to come back to work or not. Or if it's positive, then you have to maintain that 10 to 14-day quarantine period.
Okay. Okay. Thank you, Dr. Garcia, for taking some time to share your insight with us.
Yeah, of course.
And thank you to the audience for watching. Please remember the 3 Ws to preventing the spread of COVID-19. Wear your mask, wash your hands, and watch your distance. Dr. Garcia, before we go, do you have anything else?
Yes, I want to just make sure that everybody remembers to wear their mask over their nose, because I see a lot of people going like this under their nose, and that's not going to help. So we want to make sure that all of our masks are over our nose.
Yes, absolutely. Thank you. Thank you so much for being with us, Dr. Garcia. Thank you to the public. Have a great day and stay safe out there.
All right. Take care. Thank you.
Bye.
Bye.